Hi, I'm Dr. Tish Karajian, and I want to talk to all of you that are healthcare professionals about how to pick up on a patient that may be suffering from autoimmunity. First thing you'll notice when patients come in when they have autoimmune disease is most of them have not been diagnosed that they have any kind of autoimmune diseases, but they'll have a huge list of healthcare professionals that they've consulted with. I recently had a patient that had 125 practitioners they had seen. So the key feature of a person that has autoimmunity is they go from one practitioner to the next practitioner to the next practitioner. And they jump around the conventional healthcare model with different types of specialists, and they also jump around alternative medicine with all different types of specialists. And it's pretty rare to have them finally get diagnosed. And then the other key thing that you'll see with patients that have autoimmunity is, besides seeing multiple patients, is nothing's really helped them. When you look at autoimmune disease is an uncurable condition, so this is why nothing really helps them. But the key issue with it is a disease that can go into remission, and there are these periods of relapsing and remissive patterns where they're feeling great and they're feeling worse, and there's different degrees of that and different scales of that for most people. But a key second feature of patients that have autoimmune disease is that something will help for a little bit and it doesn't work. Something will help for a little bit and it doesn't work. And that's another essential feature of a person suffering from autoimmunity. A third common feature of the person who has autoimmune disease is they notice that they lose their tolerance to food proteins. So many of them have food sensitivities, and many of them have really restricted their food lists, and all types of food proteins make them sick, and the environment makes them sick. And sometimes these patients come in with their own foods because they're when they come in to visit you for an office visit, you'll see they come with a huge bag of supplements, and then their food in Tupperware, because they're really at the point where they are constantly taking lots of different supplements to survive, and their diet's very limited, and they don't trust eating out anywhere. And when you see that, as a clinician, you should be, really the lights should be going off that this person may have an autoimmune condition. So it's important that you do the proper types of antibodies to identify them. In the healthcare model, what we see is people are just checking for ANA antibodies, and if that's negative, they're told they don't have autoimmunity. But ANA autoimmunity is a very specific type of autoimmunity only to nucleic acids. So some people just have antibodies to their thyroid gland without ANA. Some people have antibodies to cartilage tissue. Some people have antibodies to their intestinal tract. There's all these different types of autoimmune presentations. So in our course, we'll be teaching you how to do proper evaluations and how to find early autoimmunity by doing the appropriate testing based on their clinical history and their presentations. And I think this will give you a tremendous tool to start to understand what some of these patients that are suffering from chronic conditions may actually have an autoimmune process, and then what you can do to clinically manage them and improve their quality of life. Thank you for your attention.